You know that feeling, right? When your usually energetic dog just seems sluggish after a normal walk.
Yeah, barely a tail wag sometimes.
Or maybe you notice your cat's meow sounds a bit weird, or they're struggling a bit with swallowing their food. It's definitely worrying.
It really is.
So today we're doing a deep dive into something that could be behind those signs. Myasthenia gravis, or MG, in dogs and cats. We've looked at a detailed overview, and we really want to unpack it for you.
Absolutely. And understanding what might be going on is, well, it's the crucial first step. Fundamentally, myasthenia gravis is about a communication breakdown
Communication between what?
between the nerves and the muscles. The signals just aren't getting through properly, leading to that weakness and fatigue you see.
Okay, so it's like a faulty connection somewhere.
Exactly. Think of it like a dimmer switch that's, flickering or just won't turn up all the way. The nerve sends the signal, but the muscle doesn't get the full message.
Gotcha. Now, our sources mentioned there are two main kinds of MG, congenital and acquired.
That's right. Congenital means they're born with it. It's there from the very start.
And acquired.
Acquired develops later on in life. So yeah, our goal here is to explore both what they look like, who gets affected, how vets figure it out, and importantly, what can be done.
Right, because knowing this stuff can help you spot those early signs, maybe understand the tests your vet might suggest.
Precisely. It empowers you as an owner.
Okay, let's start with congenital MG then, the one they're born with. How early would you even notice symptoms?
Usually pretty young. The signs often pop up between 6 and 8 weeks old.
Wow, that is young.
Yeah.
So tiny puppies and kittens.
Hmm.
And why? Is it just like random chance, or is there a genetic link? Does it run in families?
Oh, definitely genetic for the congenital form. It's inherited. Specifically, it's what we call an autosomal recessive trait in the breeds where it's well documented,
Yeah.
meaning both parents have to carry the gene, often without showing signs themselves, to pass it on to their offspring.
Okay, so both parents contribute that faulty recipe ingredient, like you said before the show.
Exactly.
And which breeds are we talking about? Are there specific ones listeners should be aware of?
Yeah, the overview we looked at flags a few. Jack Russell Terriers, Springer Spaniels, Smooth Fox Terriers.
Okay.
Also smooth-haired miniature dachshunds, a Danish breed called the Gammeldansk Hundsund, and Labrador retrievers, too.
So important info if you have or breed one of those.
Definitely worth knowing.
But overall, it's not super common, this congenital type.
No, thankfully not. Our source confirms it's considered a rare condition across the board.
And just briefly, what's actually wrong inside? You mentioned faulty connections.
Right. It boils down to problems with specific structures on the muscle cells called nicotinic acetylcholine receptors. AChRs for short.
Okay, AChRs.
Yeah.
Like docking stations.
Perfect analogy. They're docking stations for the chemical messenger acetylcholine that tells the muscle to contract. In congenital MG, these docking stations might be, well, misshapen or just don't function correctly from birth. Or there could be issues with other bits of machinery right there at the nerve-muscle meeting point.
So the hardware is flawed from day one. Makes sense.
Hmm.
Okay, let's pivot to the acquired form, the one that shows up later.
Right. This one develops after birth. And interestingly, in dogs, there are kind of two peaks for when it tends to appear.
Two peaks.
Yeah, a younger group, maybe 1 to 4 years old, and then an older group, say 9 to 13 years.
Huh. And it's more common in dogs than cats.
Generally, yes. It's not considered rare in dogs, but it is pretty uncommon in cats.
Okay, different pattern. So what's the trigger here? If they weren't born with it, why does it happen?
This is where the immune system comes in. Acquired MG is mostly an autoimmune disease.
Autoimmune, like the body attacking itself.
Exactly that. The immune system mistakenly sees those AChR docking stations on the muscles as foreign invaders.
Oh.
So it creates antibodies that attack and destroy them and damage the surrounding muscle membrane, too. The result is the same blocked communication.
So the body's own defenses mess up the signals. Is there still a genetic angle here, even though it's not directly inherited?
Good question. Yes, there seems to be. It's not simple inheritance like the congenital form, but more like needing the right genetic background, a predisposition.
Right.
Then you add in maybe some environmental triggers or infectious agents, maybe even hormonal influences. It's likely multifactorial. Certain genetic markers might just make some animals more susceptible.
Sounds a bit like some human autoimmune conditions.
Very similar concept, yes.
Are there specific breeds prone to this acquired form?
There are. The list includes golden retrievers, German shepherds, labs again, dachshunds, Scotties, Akitas.
Quite a few popular ones there.
And in cats, Abyssinians and Somalis seem to pop up more often. We also see familial forms, meaning it runs in certain families of acquired MG in Newfoundlands and Great Danes.
Okay, good to know. You also mentioned something about females in the younger dog group.
Yeah, there seems to be a slight tendency, a predilection for females to be affected more often in that younger 1 to 4-year-old group with acquired MG, less so in the older group.
Interesting. Okay, so different origins, different breeds maybe, but let's talk symptoms. What does an owner actually see? What makes you think, hold on?
That's key, isn't it? Acquired MG can be sneaky. Sometimes it's localized, just affecting, say, the throat muscles.
Okay.
Other times it's more generalized, causing weakness all over, or even, sudden collapse.
So subtle or dramatic. What specific things might someone tell their vet? What's in the history?
Regurgitation is a big one, and it's really, really important to distinguish it from vomiting.
How so?
Regurgitation is passive.
Yeah.
Food just sort of comes back up, often soon after eating, without that heaving and abdominal effort you see with vomiting.
Got it. Less drama, more just flop.
Pretty much. Also a change in their bark or meow.
A voice change. Huh.
Yep.
And then there's the classic exercise-related weakness. This is often the big clue.
The aha moment you mentioned.
Totally. Your pet seems fine resting, but gets exhausted super quickly with just mild activity.
Yeah.
Walk around the block suddenly wipes them out.
Right, that's not normal aging.
Not usually, no. Owners might also report actual collapse episodes or just a gradual weakening over time.
Yeah.
Oh, and sometimes sleeping with their eyes slightly open.
Okay, those are definite red flags. What about when the vet examines them? What might they find?
Well, funnily enough, the pet might look totally normal just chilling in the exam room.
Really?
Yeah. But the vet might notice excessive drooling, maybe see them regurgitate or make repeated swallowing motions. One thing they don't usually see is muscle wasting or atrophy. That can help rule out other muscle problems.
Okay, no muscle loss.
Usually not. If they've inhaled food or saliva aspiration pneumonia, a common complication, they might be having trouble breathing, sound wheezy.
Right, pneumonia's serious. Very. The vet might also be able to trigger fatigue or cramping with just a little exercise right there in the clinic. And a neuro exam might show subtle things,
Like what?
like a weak or absent blink reflex, the palpebral reflex. Sometimes it even gets weaker the more you test it, fatigues.
Interesting.
Same for the gag reflex, might be poor or gone. Leg reflexes are usually okay, but even they can fatigue sometimes, though that's less common.
And you mentioned something specific in cats.
Ah, yes. Ventriflexion of the neck, where they hold their head kind of drooped down towards their chest. More common in cats with MG, less so in dogs.
Okay, so it's a whole collection of signs, really. And that exercise weakness seems key. So if MG is suspected, what's next? Diagnosis.
Diagnosis involves pulling everything together. The owner's history is vital, then the physical and neuro exams. But yeah, specialized lab tests are usually needed to confirm it, especially for acquired MG.
What's the main test for that?
The big one is the serum acetylcholine receptor antibody test, the AChR antibody titer. If that comes back high, it strongly points towards the immune system attacking those receptors, confirming acquired MG.
Makes sense. Any other blood tests?
Vets might run thyroid or adrenal function tests too, partly to rule out other things that can cause similar signs or sometimes occur alongside MG.
What about x-rays or ultrasound? Do they help?
They definitely can. Chest x-rays are super important.
Why is that?
They can show if the esophagus is enlarged, that's Megaesophagus, common with MG because those muscles weaken. They can also spot masses in the chest, particularly in the front part, the cranial mediastinum.
Masses.
Yeah,
Like tumors.
exactly. Specifically, they're looking for something called a thymoma, and x-rays also show if there's aspiration pneumonia.
Okay, so chest x-rays are key. You mentioned other procedures too. Biopsies, medication tests.
Right. If they see a mass on the x-ray, an ultrasound-guided biopsy can confirm if it's a thymoma. Then there's the Tensilon test, using edrophonium chloride.
Tensilon test. What does that do?
It's a drug that briefly boosts the nerve-muscle communication. If the animal suddenly gets stronger for a few minutes after the injection, that supports MG.
But it's not foolproof.
No, definitely not. You can get false positives and false negatives. Sometimes just seeing that weak blink reflex suddenly return after the drug is suggestive.
Okay. What about electrical tests?
Electrophysiology. Used less now, partly because the antibody test is so good, and partly because anesthesia can be risky for some of these patients, and you often need it for those tests.
Gotcha. Anything else?
Maybe an ECG, an electrocardiogram, just to check the heart rhythm, as some dogs with acquired MG can have a slow heart rate or other rhythm issues.
Wow, quite the workup. So, besides congenital and autoimmune causes, are there other triggers? You mentioned thymoma.
Yes, that's a big one. It's called a paraneoplastic cause. The thymoma, a tumor of the thymus gland in the chest, seems to mess with the immune system, triggering the attack on the AChR receptors.
So the cancer can actually cause the MG.
It seems so. That's why checking for thymoma is so important. Also, in cats, treatment with a thyroid drug, methimazole, has sometimes been linked to a reversible form of MG.
Interesting.
And vaccinations might potentially worsen active MG, so that's something vets consider. Oh, and being an intact female dog seems to slightly increase the risk for the acquired form.
Okay, lots of factors. So, let's say a pet gets diagnosed with acquired MG. What's the treatment? Is it manageable?
Yes, acquired MG is definitely treatable. It takes dedication, often months of care, but many pets do well.
What's the main treatment?
The foundation is usually anticholinesterase drugs. Pyridostigmine bromide is the common one.
How does that help?
It stops the body from breaking down acetylcholine so quickly at the nerve muscle junction. Basically, it makes the available messenger hang around longer to get the signal across.
Okay, makes the signal stronger, essentially. What if that's not enough?
Then immunosuppressants might be added. Corticosteroids like prednisone are often the next step to calm down that autoimmune attack.
Right, reduce the friendly fire.
Exactly. And if steroids aren't working well or cause side effects, other drugs like azathioprine or mycophenolate might be used instead or added on.
Sounds like medication is key.
Right.
What about other care? Supportive stuff?
Hugely important. Animals might need to be hospitalized at first to get the meds right and monitor them. If they have aspiration pneumonia, it's intensive care, oxygen, antibiotics, IV fluids.
Fine eating, if they can't swallow well.
A feeding tube, often a gastrostomy tube going directly into the stomach, might be needed. This ensures they get calories safely. Small, frequent, high-calorie meals are typical, plus careful hygiene around the tube site.
Makes sense.
And even simple things like raising the food in water bowls can make a big difference for some pets.
What about the thymomas? Can they be removed?
Yes, surgery is usually recommended if a thymoma is found, but you need to get the MG stabilized first with medication and treat any pneumonia.
Right, stabilize before surgery.
And interestingly, sometimes the MG isn't obvious in thymoma cases initially, so vets often test for MG before thymoma surgery anyway.
Good practice. Are there medications or things to avoid if your pet has MG?
Definitely. A whole list of drugs can worsen the weakness by interfering with nerve muscle transmission. Things like certain antibiotics, aminoglycosides, some heart meds, tranquilizers, anesthetics, strong painkillers, muscle relaxants, even magnesium supplements.
Wow, quite a few potential pitfalls.
Yes. Also, vets are usually cautious with barium contrast studies for Megaesophagus if X-rays already show it clearly due to aspiration risk. High-dose steroids need careful consideration, and generally avoiding non-essential vaccinations while the MG is active is advised.
Okay, so once treatment starts, how do you know it's working? How are these pets monitored?
You watch them closely for returning strength, better activity levels. Vets often repeat chest X-rays every month or two initially to see if the Megaesophagus is improving.
And the antibody test.
That gets rechecked too, maybe every 2-3 months. Seeing those antibody levels drop towards normal is a great sign the treatment is working and the immune attack is easing off.
So what's the overall prognosis? Can they get back to normal with acquired MG?
It really depends. If they don't have severe aspiration pneumonia or really bad throat weakness, the prognosis is often quite good for recovery. Many dogs can come off medication completely within, say, 6 to 8 months.
That's encouraging.
It is. But if there's a thymoma, it's more guarded. Depends on successful surgery and controlling the MG. And the sources really stress how crucial a dedicated owner is. Consistent care and medication are non-negotiable for a good outcome.
Makes sense. It's a commitment. What about the congenital form, though?
Unfortunately, the prognosis for congenital MG is generally considered poor.
Right, that's tough. Okay, we've covered a lot. To wrap up, what are the absolute key takeaways for listeners about myasthenia gravis?
I'd say remember it's a nerve-muscle communication problem. 2 main types. Congenital, born with it, rare, poor prognosis, and acquired, autoimmune, treatable.
Got it.
Recognizing signs like exercise weakness and that passive regurgitation, not vomiting, is vital. Diagnosis often relies on the AChR antibody test for the acquired form. And treatment involves specific meds plus really important supportive care.
Yeah, for me, those big aha moments were definitely linking that sudden fatigue with exercise to MG and getting clear on regurgitation versus vomiting. And knowing the breeds that are more predisposed is super useful too.
Absolutely. And thinking about the autoimmune nature of acquired MG, its links to things like thymoma, maybe even medications, it really makes you appreciate how complex the body's systems are.
True, how everything's connected.
Right. It just highlights why careful observation of our pets is so important and getting things checked out promptly. It makes you wonder, doesn't it? Thinking about that immune system, nervous system link, what other subtle things, maybe environmental factors, could be playing a role in conditions like this?
Yeah, definitely food for thought. It shows there's often more going on under the surface than we initially see.